morning I actually have some good news to pass on to you. So you're here at a historic event in the Christie administration. Actually, the governor getting to tell you something that's good news. And it applies directly to seniors. And you know, when I was going through the budget cuts, literally the second to last cut that I decided on, because it was so difficult for me and so contrary to what I wanted to do to try to bring a balanced budget, were the changes that we were suggesting to make to the prescription drug programs that apply to seniors, PAAD and Senior Gold, increasing the deductible to $310 and doubling the co-pays on brand name drugs. Now, I didn't want to do that, and right up until the last minute, I kept putting that decision off. And the second to last decision I made was that one, to put that cut in the fiscal year 11 budget, because I simply couldn't find the money. And that was the second to last cut I made. The education cuts were the last ones I decided on. The two most difficult decisions I felt like I had to make in the budget. But the good news I have for you today is that when we made those decisions, we were working off preliminary numbers that we were getting regarding everyone's use of that program, and also it was before federal health care was passed by President Obama and the Congress. Those two changes have allowed me to be able to let all of you know today that I will be sending to the legislature during this period when we're allowed to send budget fixes, a budget fix that says we will not change PAAD and we will not change Senior Gold one bit. It will go back to regular. And it's one of the happiest things I've been able to talk about in the first 4 months I've been governor. Here's how we did it. There are lower drug costs in the program because all of you are using generics more. Yes. And so that's lowered our costs in the program over the last number of months. Secondly, manufacturers are giving higher rebates to the state when you use their drugs. And that's accounted for a significant amount of money. Higher rebates from the pharmaceutical companies have allowed us, and we apply for those rebates for you, and we get those rebates back in the state in the program. We've gotten much more money back in from the manufacturers than we thought we would. Third, because of changes to Medicare Part D and the open enrollment to an expanded universe of people, that reduces the amount of people and the amount of money that we have to use in the PAAD program. So that's been a significant help as they changed Medicare D. And lastly, because of the health care reform that was passed, there's a provision there that will provide 50% discount on brand name drugs in Medicaid Part D in the coverage gap, you know, they call it the donut hole. And so there'll be 50% more money there beginning in January of 2011. That was money that we couldn't have anticipated before because we didn't know whether Congress was going to pass health care reform, and if it was, what it was going to look like. Those 4 changes allow us to restore the program in its entirety without increasing taxes on anybody. And I think that's great news for seniors, and it's even better news for what the mayor was talking about, which is job creation and job growth in New Jersey, because we're the worst taxed state in America. You all know it. And that's why businesses are leaving places like Linden and all over the place, because they're going to places like Pennsylvania and other places whose taxes are significantly lower than ours. And so the ability of us today to be able to tell all of you we can keep PAAD and Senior Gold where it is for all of you, so your prescription drugs won't cost you any more than they cost you right now, is something I feel good about, because we not only were able to do it, but we're able to do it without increasing anybody's taxes. And that's going to make New Jersey a business-friendly place, and we're going to start to grow jobs again if we keep taxes down. So I'm happy to be able to give you some good news.